Hello, good morning everyone. Today I shall discuss the role of pumpkin seed extract in the treatment of benign hyperplasia of prostate. Let me clarify, I am not an Ayurveda expert. Therefore, if anyone with BHP wants to take pumpkin should take under the uh, guidance of Ayurvedic expert. Indian pumpkin is available in several varieties, and one of them is F1 hybrid, which is a different hybrid form and may have several hues. The creeper pumpkin belongs to Curcubita pepo, and other varieties are also there that are grown in Austria, Hungary, Mexico, China, and many other European, African, Asian countries. In India, four varieties are quite common: Arka Suryamukhੀ, Pusa Vishwas, Punjab Samrat, and F1 Hindu hybrid. Seeds are usually large in size, and they are rich sources of fatty acids and fatty acids of polyunsaturated and monounsaturated type, and that is good. Uh, in addition to the fatty acids, tocopherol, beta-cetoestrol, and delta-7 phytoesterols are the constituents of the seeds that provide medicinal value to it. They are useful as anti-inflammatory, antioxidant, antiviral, hepatoprotective, antihypertensive, and anti-diabetic supplements. Experimentally, seeds have been found to have anti-cancer. The calorie content of the seeds is low, and most of the oils which I spoken are unsaturated variety, and some of them support the growth of intestinal microflora, meaning thereby they are good to the stomach or gut health. Pumpkin pulp, its main nutrient which is used as food, has polysaccharides, terpenoids, carotenoids, amino acids, proteins, and minerals. Seeds also contain minerals, zinc, phosphorus, magnesium, which is actually higher than peel and pulp. Potassium. Now, medicinally, the pumpkin is quite popular in many countries, not only in India, and it is popular because of its nutritional value. About 500 to 600 calories per 100 grams is there in seeds because of fatty acid content, and fruits also have calories which are lower than the other. Other components are there. Large amount of vitamin A and vitamin B complex is also present, and which is higher in the peel. In Unani medicine, pumpkin seeds are considered to be important for the treatment of worms, as diuretic, as laxative, as tonic, and demulcent, alone or in combination. Maximum quantity of raw or roasted fish to be consumed daily is 28 grams, and it should not be exceeded because this is the usual dose. Recommended is 10 to 20. Now, chemical active components are carotenoids, flavonoids, tocopherols, and phenolic acids, and each has different tissue protective effect. For example, carotenoids have protective effects on the eye, and they act as antioxidants. Flavonoids, rutin, astragalin, quercetin, and others. They are neuroprotective, has anti-tumor action, they protect heart, and may show anti-diabetic activity. Tocopherols are antioxidants, and phenolic acids, particularly chlorogenic acid, gallic acid, vanillic acid, and hydroxybenzoic acids, they have actions as tissue protection in cardiovascular system, brain and GIT. Have antioxidant, antiplatelet and anti-inflammatory activity, particularly HPA. And chlorogenic acid is found to be useful in the treatment. Now, overall experimental and human evidence of their effects include antioxidant, anti-diabetic, anti-androgenic activity, relaxation of urinary bladder, anti-cancer activity, neuroprotective activity, hepatoprotective activity, cardiovascular protective activity, anti-inflammatory activity, anti-infective activity against some infections, and gastroprotection, anti-ulcer activity. Urinary bladder relaxing activity, anti-apoptic activity, and anti-androgenic activity are useful in the treatment of enlargement. Now, phenolic extracts have most antioxidant activity, whereas acetone extracts of the seeds have most lipoxygenase inhibiting activity. Ethanolic extract is also used in some formulations. Defatted pumpkin seed extract is also available for therapeutic use in Germany and many other countries. Water-soluble liquid extract is formulated is available in India, and pumpkin seed oil is also available as topical preparation for heat. Now, usual therapeutic formulations are capsule which contains the specialized preparations, for example Euromedic pumpkin, and tablet which also contain hydroethanolic acid, IFLA 940 and IFLA hyperpure. One tablet contains 500 mg of the extract, that equivalents to 350 mg extract, and or 10 gram of the pumpkin seeds. Capsule also contains 500 mg of the extract. These are actually oily preparations encapsulated or formed in tablet, or they are defatted. Now, in India, we have some formulations, and because they are not essential drugs, not under drug price control, several forms are available online and also on the medical stores. Each tablet or capsule usually contains 500 mg extract or oily extract. Benign prostatic hyperplasia or benign hyperplasia of prostate is a common age-related disorder and is characterized by troubled urination in form of slow stream, frequent urination, urge to urinate, dribbling, and higher residual volume in the bladder due to incomplete evacuation. Symptoms are collectively called as LUTS. Uh, the hindrance to flow due to enlarged prostate is by two mechanisms. One is the dynamic obstruction is due to overactivity of the smooth muscles of the triangular area near outflow and internal sphincter, and this can be overcome by using relaxants, particularly selective alpha-1 blockers such as tamsulosin and silodosin. The second component is static structural component, that is fixed. It is due to enlarging prostatic mass that obstructs the passage, and particularly when middle lobe is enlarged, the passage is obstructed and there is difficulty in urination. Now, this dynamic component can only be reduced gradually by longer use of a special group of drugs called as 5-alpha reductase inhibitors, and examples are finasteride and dutasteride. A combination of these two groups, Fina with tamsulosin or psilocin, Duta with tamsulosin or silodosin, is a very commonly used drug for the treatment of prostatic hypertrophy, and it is found to be effective and safe for long-term use. The interest in the herbal natural products emanates from anecdotal reports on the beneficial effects of these herbals on the symptomatology and the benign hypertrophy prostate. and about 30 herbal compounds have been investigated for its utility. I shall discuss the role of pumpkin seed extracts in benign. Librand et al. Conducted a pilot study of oil-free hydroethanolic extract of pumpkin seeds in 60 men with enlarged prostate. One tablet of 500 milligram extract was given before bedtime for 3 months, and the result was a significant reduction in nighttime urination and reduction in the bladder residual volume. The International Prostate Symptom Score is a standard questionnaire for evaluation of the effect, and it was reduced significantly by 30% after 3 months of the severity of BHP as seen by IPSS score, quality of life, post-word urination, and tolerability. All were in favor of use of pumpkin seed. Now, the main mechanism of improvement was studied by Kang et al. And they found that the active ingredient total phytosterols showed the activity in the experimental animals rats when the hypertrophy was induced by the use of testosterone. The reduction in the pathological features of the hypertrophic prostate were seen. There was suppression of the expression of the markers of hypertrophy, alpha reductase enzyme, androgen receptors, co-activators, all were reduced, and there was less expression of apoptosis related growth factors, transforming factors, proliferative inhibiting effects were also seen. So overall there was benefit in the prostatic hypertrophy by the use of the drug. So the authors concluded that experimentally phytosterols are the main ingredients responsible for reduction in the. Many more studies have been done and two important meta-analyses are discussed here. One meta-analysis is of the two randomized controlled trials which used seed extract in the capsular form 500 mg twice daily for 12 months, that's quite longer, and it was found that the use of extract reduced the obstructive symptoms, so there were benefits in the symptomatic relief. Another meta-analysis of 10 eligible studies was done recently by Rangita et al. From Sri Lanka, finding out the measurements of IPSS quality of life, LUT symptoms, that is prostatic volume, uroflow rate, post-voidal residual volume, frequency, nocturia, erectile dysfunction, and the level of prostate-specific antigen, PSA. The results were that in all relevant studies, intervention group, that is the pumpkin seed extract receiving group, demonstrated significant reduction in the IPSS record and they improved quality of life. In one study, each showed reduction in the prostatic volume, residual volume. 3 studies showed reduction in urine flow rate, that is improvement in the urine flow rate, and there was no rise in the prostate-specific antigen. Therefore, authors concluded that pumpkin seeds may be beneficial in reducing the symptom score and to some extent in improving prostatic and residual volumes. Urine flow rate is increased and quality of life is. Limited evidence is there for actual size measurement after the drug, and the evidence has recently been put forward by the Al-Shaka et al. In 2025, this year, in dogs in whom Hypertrophy was induced by testosterone and pumpkin seed extract was given. It was found that it mitigates the growth and hyperplasia of dog prostate as evidenced by substantial reduction in the prostate length, depth, height and volume along with decreased PSA level. So in summary and conclusion, there is an accumulating evidence on the beneficial effects of the prostate PSE, that is pumpkin extract, in improving symptoms as scored by Europollometry and IPSS score. There is an experimental evidence on the mechanism of beneficial effects which induce reduction in the growth, increase urine flow, have antioxidant activity and tissue production. There is a scant clinical evidence to show that the pumpkin extract used alone decreases prostate size significantly, and there is a need of large-scale clinical studies done carefully to evaluate the impact of long-term use of the seed extract and see the reduction in the prostate size by ultrasonography, particularly volume, middle lobe, and in addition to the symptomatological improvement, and that will ascertain the role. Therefore, as on today, pumpkin seeds or its extracts may be useful as dietary supplements to help improve symptoms of benign prostatic hyperplasia. It is well tolerated as such. The dose should not be exceeded, that is, the seeds should not be taken in doses more than 20 to 30 grams per day because they have calorific and nutritional contents also. They are the references which can be accessed for further reading, and more information about herbs can be obtained from this YouTube site. And thank you very much.